If every step feels like you're walking on a ticking time bomb because of your disc bulge, you're not alone. I've worked with countless patients who thought walking would make things worse until they learned the right way to start. By the end of this video, you'll know exactly how to walk safely and confidently again. No flare-ups, no guessing, and no fear that you're damaging your spine. You'll have a clear routine that protects your back before you ever take that first step. We'll break down the exact pre-walk setup most people skip, posture check, core activation, the right shoes and terrain, plus how to adjust your walk if the pain shows up. And at the end, I'll share one simple cue that can turn a painful walk into progress. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. I help people get relief from disc bulges, sciatica, pinched nerves, and chronic spinal issues without surgery or medication using chiropractic corrective care. Subscribe now if you want simple exercises and proven tips to help you feel better, move better, and stay pain-free. If you've been told to just walk because it's good for your back, but every step sends a dull ache or a sharp twinge down your leg, I get it. That advice can feel like a trap. Walking should help a bulging disc heal, but only if your spine is ready for it. The real problem isn't the walk itself, it's what's happening before you start. So before you lace up your shoes, here's what you need to know to make walking safe, supportive, and actually healing for your back. Step number 1, posture check. Before you take a single step, fix your posture. Most people with a lumbar disc bulge start walking slightly hunched or with their hips tucked under, which puts constant pressure on the disc and irritates the nerve. The goal is to create space in your spine, not tension. Here's how to set up safely. Stand tall with your feet shoulder width apart, knees relaxed, and shoulders rolled gently back. Place one hand on your lower stomach and one hand on your lower back. Think of it like you're stacking your rib cage directly above your hips. Your weight should feel balanced between both feet and not heavy on your heels or your toes. Then take a slow breath in your nose and picture your spine lengthening slightly as you exhale. This small adjustment reduces compression and helps your disc sit in a neutral, supported position. Check in often while walking every few minutes. Ask yourself, am I standing tall or collapsing forward? That one habit alone can reduce leg symptoms and back tension within days. Once your posture is stable, next step is to wake up the muscles that protect your spine from the inside. Step 2, core activation. Now that your posture is solid, it's time to turn to your core. When you have a lumbar disc bulge, your spine needs support from the muscles around it, not bracing that locks everything tight. The goal is gentle stability. Here's a simple way to do it. Place your hands on your lower abdomen, take a slow breath in your nose, and as you breathe out, lightly tighten your belly like you're preparing for a small tap, not a punch. You should feel a mild tension that you can still breathe through. That's your deep core waking up, especially the muscles that protect your lower spine. Practice this while standing before you walk, then maintain about 20% of this engagement as you move. It keeps your spine stable and it takes pressure off the irritated disc. If you start to feel your lower back tighten or your abs switch off, pause for a second, reset, and reactivate. A strong but relaxed core is your built-in brace for every step you take. With your core engaged, the next step is choosing the right foundation. The wrong shoes or surface can undo all of your progress before you even get moving. Step number 3, shoe and surface setup. Your shoes and the surface you walk on can completely change how your back feels. If your shoes are too soft or worn out, your feet collapse inward with each step. That twist travels up your leg and ends up stressing your lower back. A good running shoe often gives the best support for walking with a disc bulge. Choose one that feels firm under the heel and then supported through the arch. If your shoe bends or twists easily, they're not supporting your spine. They're working against you. Start on a flat, even ground. Pavement, a treadmill, or smooth walking track are ideal. Avoid heels, sand, or uneven trails until the symptoms have improved for several weeks. These surfaces make your back work too hard to stabilize and can flare up your disc. Before each walk, do a quick check. Stand in your shoes, shift your weight side to side, and make sure your feet feel stable. If one side feels heavier, reset your stance until you're balanced. That small fix can prevent a lot of irritation later. Once your foundation feels solid, it's time to start moving, but how you begin the walk matters just as much as the setup. Step number 4, gentle start and awareness. Now it's time to walk, but take it slower than you think. When you have a disc bulge, your body needs time to trust movement again. Start with just 5 to 10 minutes at a pace where you can breathe easily and focus on how your body feels. Keep your steps small and steady, land softly on your heel and roll through to your toes, letting your hips and arms move naturally. This rhythm helps your spine move in a controlled way instead of jolting with every step. If you feel sharp pain, tingling, or shooting discomfort down your leg, stop and rest. That's your body telling you your disc or nerve is being irritated. But if you just feel mild stiffness or light pressure, that's okay. It often eases as your muscles warm up. The key is consistency. A short, pain-free walk done correctly is far better than pushing through a long one that sets you back. Once you finish your walk, what you do next can help your spine recover faster and prevent that post-walk tightness from coming back. Step number 5, post-walk reset and progression. Once your walk is done, don't just stop and sit. That sudden change can tighten your lower back and increase pressure on the disc. Instead, give your spine a short reset. Lie on your stomach for 1 to 2 minutes or stand and gently arch backward with your hands on your hips. This helps the disc shift back toward its normal position and relieves pressure from the nerves. Then move into a few slow cat-camel stretches. Focus on smooth motions through your spine, rounding gently on the exhale and extending slightly on the inhale. This keeps your lower back mobile without aggravating the disc. As your body adapts, increase your walk time by about 5 minutes each week. Pay attention to how your back feels the next morning. If you wake up sore or with leg pain, scale back slightly. Progress should feel steady, not forced. This reset routine keeps your spine flexible and prevents flare-ups as you build endurance. In the next part, I'll show one small adjustment that can instantly make your walk smoother and more stable. Here's your bonus tip. Before you start with your next walk, try this small adjustment that most people overlook. As you walk, gently press your big toes into the ground when your foot lands. It sounds simple, but it helps your glutes and deep core muscles fire together, giving your lower spine extra support. This small cue keeps your pelvis stable and reduces that jarring pull that often irritates a bulging disc. If you feel your back relaxing instead of tightening, that's a sign you're walking the right way. Keep the movement slow, smooth, and intentional. Over time, this habit can completely change how your body tolerates walking. If you're dealing with a disc bulge and every walk feels like a reminder of your pain, don't give up. Walking can still be one of the best things you do for your back when it's done right. Each step you take with awareness and preparation helps your spine heal and rebuild confidence. Even if you're struggling right now with back or leg pain from a lumbar disc bulge, you can get through this. Recovery doesn't happen overnight, but it does happen when you move the right way and stay consistent. If you want more simple tips and strategies to relieve pressure, strengthen your spine, and exercise safely with a disc bulge, check out the other videos on my channel. If you found value in this video, like and share it so others dealing with the same pain can find real help as well. And tell me how you did after trying these strategies. Drop a comment below. I read and respond to everyone. And remember to subscribe if you want more simple exercises and proven tips to help you feel better, move better, and stay pain-free. The next video you should watch is 5 gentle daily moves to relieve lumbar disc pain. Go watch that video next. It's the perfect follow-up to this one.